Welcome back. Imagine spending half of your month with headaches. For some, that's a reality. Chronic migraine is a distinct neurological disease with patients experiencing 15 or more headache days per month. Dr. Kerry Knievel is a neurologist, and she's here to offer insight on treating chronic migraines. Take a look.
Hi, I'm Dr. Kerry Knievel. I'm a headache specialist, and I'm here to talk about chronic migraine. Chronic migraine is a headache that occurs on greater than 15 days out of the month, so more than half of days, and 8 or more of those days have associated features including nausea, sometimes vomiting, sensitivity to light and sound, slowing of thinking, and limitation of daily activities. So this is significantly impactful on patients' lives. The attacks are unpredictable, so they don't know whether it's going to be important day at work, something important with their family or friends, and they get these unpredictable migraine attacks. So it really affects every aspect of their lives. So there are treatments for chronic migraine. Botox injections are one of the treatments. It's been FDA approved for treatment of chronic migraine since 2010. It's typically injected by a neurologist or headache specialist in the forehead, temples, back of the head, neck, and shoulders, and it is covered by most commercial insurance plans. There can be side effects, as with any medication. The most common side effects that we saw in the clinical trials were neck pain and sometimes eyelid weakness. However, we've changed the way we do the injections since the trials were completed, and I very rarely see these in my practice. Other more serious side effects could potentially happen, including difficulty with breathing or swallowing. However, I've never seen these in my practice, in my experience. So for more information, you can visit BotoxChronicMigraine.com, where you can find more about safety information, full product guide, and information about the black box warning with Botox. Thank you.
And a special thanks to Allergan for bringing us that information, and we will be